on TikTok, somebody said she has been using Postinor every day simply because she and her husband are not ready for pregnancy. And it got me thinking that that's not the best drugs to use when you want to prevent pregnancy. Okay, that's aside. Hi guys, welcome back to my channel. If you're a returning subscriber, welcome. And if you're new here, please kindly stay subscribed. Levofem and Postinor are both hormonal pills, but they are used different ways, sometimes for different situations. So in this video, I'm going to be talking about how Levofem works and comparing it a little bit with Postinor. Levofem is a contraceptive pill which is meant to be taken every day at the same time with or without intercourse. Well, Levofem can also be used to treat some menstrual disorder like dysmenorrhea, menorrhagia, endometriosis, ovulation pain, and also premenstrual syndrome. So when you see a woman taking Levofem, don't just imagine she's using it as a contraceptive. Some people want to treat irregular period or some menstrual disorder. How does Levofem work? The first thing is that it stops your ovary from releasing egg. That is, it stops ovulation. And when you are not ovulating, there's no way fertilization is going to occur because pregnancy revolves around ovulation. Fertilization occurs when there is fusion between the men's sperm and the women's egg. So when the woman did not release egg, there's nothing the sperm is going to attach itself to, and by so doing, fertilization will not occur. The next thing is it makes the lining of the womb to be thinner. Now, even if your body should now release that egg, the egg will not be able to catch up with the sperm that has been released by your husband during intercourse. When the lining of the womb is thinner, the egg will not be able to attach itself with the sperm. The next thing is it thickens your cervical mucus. That is, sperm will not be able to swim through. Now, if all these things I've mentioned before even occurs by mistake, or even if your egg tries to attach itself to the sperm, it will thicken the cervical mucus in such a way that the sperm itself will not be able to swim through to attach itself to the egg. Levofem contains 28 pills, 21 yellow pills and 7 white pills. The 21 yellow pills is the one responsible for preventing pregnancy. It carries the active ingredients, which is the levonorgestrel hormone. Okay, the white pills are the iron tablets. Okay, so you are meant to use the yellow pills 21 days at the same time. If you start Levofem this afternoon and you start by 2 p.m., you are meant to be using it by 2 p.m. every single day for 21 days. If you forget to take one, maybe you are supposed to take it by 2 p.m. and you've forgotten, you can take it as soon as you remember. You can even take 2 tablets in a day. That is the one you forgot to take and the one you are supposed to take at that particular time. And when you finish taking the yellow pill and you start taking the white pills, you might experience light bleeding. But if you do not want to experience this, you can skip it and start taking the yellow pill in another sachet, because it contains 3 sachets in a pack. That is 28 sachets in one. If we are going to count the white pills to its 28 multiplied by 3, and if we are not going to count the white pills, if it's just the yellow pill you want to take, 21 by 3. Levofem works with consistency. There are some side effects you can experience when you take Levofem, which includes nausea, headache, breast tenderness, and change in your mood. Let me end this video by saying Postinor and Levofem are not the same thing. You are meant to use Postinor within the maximum of 72 hours after intercourse. That's if you do not want to get pregnant. It is an emergency period. I have a video talking about Postinor. I'm going to put the link in the description and also here. And Levofem is to be taken with or without intercourse. That is, whether you have intercourse or not, you are meant to take Levofem so as to prevent pregnancy. Because if you skip days without taking it, you can end up getting pregnant. I do not advise anyone that is single to be taking it if you are not taking it for any menstrual problem. That's all about this video. Like this video, drop your thought down in the comment section. Share this video to every woman you know. If you are yet to subscribe, make sure you hit the subscribe button, turn on the notification bell so you'll be the first to get notified whenever I drop a new video. Catch up with all my previous videos. You are going to love and enjoy them. And follow me on all my social media platforms. The links are in the description. See you in my next one. Bye guys.